لا لا، لما بدك هات بتكمل أنا.
Good morning, everyone. Thank you very much for taking the time to be here with us today. My name is Mohammad Abu Audeh, and I am the Monitoring and Evaluation Team Leader at UNRWA. I am joined by my colleagues, Maili Hedi and Mona Lubbad. Before we begin the rapid gender analysis session, I would like to briefly introduce our monitoring and evaluation team. The team has good experience in humanitarian and development work, focusing on M&E systems, results frameworks, and promoting evidence-based decision-making. For this exercise, my role is to ensure that the data we generate is reliable and effectively used to inform programming. I am joined by Mona Lubbad, our Monitoring and Evaluation Reporting Officer, who has a good experience in reporting and communications. Mona plays a key role in translating complex data into clear, actionable messages that supports accountability and advocacy. Also with us is Maili Hedi, the Monitoring and Evaluation Officer with a good experience in data analysis and performance tracking. My focus is on data quality and ensuring that our analysis is accurate and meaningful. Together, our team will support data collection, ensure quality analysis, and help translate findings into practical insights for programming. Today, we will be sharing key findings from a rapid gender analysis conducted in Gaza with a particular focus on how this crisis is affecting women, men, girls, and boys differently. And most importantly, what these differences mean for how we design, monitor, and adapt humanitarian responses. This presentation is part of the Glocal Evaluation Week, a Glocal Evaluation initiative that reminds us of something critical. During and after the presentation, we encourage you to use the chat to share your questions and comments so we can make the most of our time together. As this presentation is part of a Glocal Evaluation Week that reminds us of something critical, that evidence should drive action, not just reporting. Today is not only about sharing findings, it is about asking ourselves, are we responding in ways that are truly equitable, effective, and accountable? So this is not just a presentation, it is a conversation about improving how we respond to crises in real time. Let's begin with a simple but important question. Why do we conduct a rapid gender analysis? In fast-moving crises like Gaza, where a lot of emergencies and crises, information becomes outdated very quickly, as the situation is changing all the time. In the traditional assessments, we can take weeks or even months to finalize. But by the time they are finalized, the reality on the ground may have already changed. So what we need instead is a timely, actionable evidence that supports real-time decisions. This rapid gender analysis brings together multiple sources of information, monitoring data, sector reports, community feedback, and established gender frameworks. And what's importantly, that this is not done by one organization alone. It is an interagency effort by multiple agencies, which strengthens coordination, builds shared understanding, and supports collective advocacy. So this is not just another report. It is a decision-making tool, a tool that helps us adapt, coordinate, and remain accountable to affected populations. To truly understand the findings, we must first understand the context of Gaza. Gaza today is facing massive displacement, widespread destruction of infrastructure, and a near collapse of essential services that people depend on for survival. But there is one message we must be very clear about, which is crises are not gender neutral. For women and girls, we see increased caregiving responsibilities, restricted mobility, and higher exposure to protection risks. For men and boys, we see different but equally critical challenges: conflict-related threats, loss of livelihoods, and significant psychosocial stress. And beyond these impacts, gender also shapes very practical questions, which are who access assistance, how safely they access it, or they access the assistance, and who ultimately controls the resources. So when gender is overlooked, we risk designing responses that are ineffective or even harmful. Let's now briefly look at how this analysis was conducted. The rapid gender analysis uses a mixed methods approach, which is combining a quantitative data with a qualitative insights, which includes field monitoring, remote data collection, and secondary data review. Remote methods are especially important in Gaza, where many areas remain inaccessible. In a situation like Gaza, many areas remain inaccessible to reach. One key strength of this analysis is the use of disaggregated data that is broken down by sex, by age, and by disability. This allows us to move beyond averages and really understand who is affected and how. Given the constraints, we prioritize three key principles, which are speed, relevance, and ethical data collection. And what's importantly, this is a living analysis. It evolves as the situation evolves. So the goal is not to get perfect data. The goal is to have useful data when it matters most. So the goal is not to get perfect data, it is to get useful data. We will now move to the key gender findings emerging from this analysis, and our colleague Mona will walk you through these in more details.
Hello, everybody. I really would like to express my pleasure to be here with you. And I would like to thank all of you for joining us and would like to warmly welcome every one of you before I start this speech. As my colleague Mohammad said, I'm going to walk you through these key findings, gender key findings. One of the most significant shifts, as we can see, we observe that the increase in female-headed households is largely driven by different reasons, like displacement, family separation, and men loss, or even men detention. These households often face higher dependency ratio, limited access to income, and increased protection risks. And of course, this creates a challenge because many humanitarian programs were not originally designed for this reality. As we know, the traditional targeting approaches may miss these households entirely. So what do we need to do here? Actually, we need a dynamic targeting, continuous monitoring, and a shift in how we see women, not only as a caregivers. No, the role here is completely different and it changed. She is also as a decision makers and economic actors. And here, as you can see, we are also witnessing a major shift in gender roles. Women are now taking on different responsibilities like food provision, water collection, income generation, and also caregiving responsibilities. The workload has truly increased. It is increased significantly, but this doesn't automatically mean empowerment. In many cases, women still lack decision-making power. And this is for different reasons, maybe for psychological reasons, for social reasons, and control over resources is still limited for women. So from an M&E perspective, we need to measure not access, but also agency, influence, and control. More work does not mean more power, not at all. That doesn't mean that you have a lot of responsibilities, a lot of roles, that you are in a powerful place. And also another critical finding here is the rise of in negative coping strategies. Families in Gaza are going through difficult situations, and these situation forced them to use negative coping strategies, like families, for example, are skipping some meals, or withdrawing children from schools, or sending their children to work, and in some cases resorting to early marriage. These, as you know, are not temporary adjustment. They are decisions with long-term consequences and influences on their lives, especially for women and girls who face lasting impact on education, health, and protection. And this is why tracking these coping strategies is important. They are early warning indicators. I mean here, tracking these strategies are early warning indicators. They tell us where conditions are deteriorating and where urgent intervention is needed. Now, let's go through sectorial inequalities. Gender inequalities exist across all the humanitarian sectors like food, water, health, shelter, and education. And these are not isolated issues at all. They are interconnected and reinforce each other. Protection risks also include gender-based violence are increasing in Gaza due to different, reasons and conditions, due to overcrowding, due to economic stress, and the breakdown of social systems. So, and we can say critically, protection is influenced by how aid is delivered. Protection is not one sector's responsibility. It is everyone's responsibility. And also, we observe a decline in women's participation in the community decision-making. And this we can say affects many things like program quality, accountability, and even trust. Because, without participation, we cannot design effective or inclusive programs. So participation from the women's side is so crucial in programming and in delivering or in making any decision in humanitarian intervention. This is all from my side. Thank you for listening. And now we will move to M&E lessons and practical guidance. And with my colleague, Mai, as she will guide you through this part. The floor is yours, Mai.
Thanks, Mona. Hello, everybody. I am May, MND officer. We will now move to MND lessons and practical guidance. And my colleague, okay. Can Mona, yes. In high risk and rapidly changing environment, we must adapt how we work. We based on remote data collection, rapid assessments, and community-based approaches. The key principle is simple. Timely data is more valuable than perfect data. Gender analysis must directly inform what, who we target, how assistance is delivered, how risks are mitigated. And monitoring must be beyond outputs. We must track power, safety, equity. Gender is not an add-on. It's central to program effectiveness. To conclude, gender shapes, access, safety, and outcomes. Strong M&D system helps us identify equalities, adapt to programs, and strengthen accountability. The message is clear here. We must embed gender into everything we do. Why? Because without gender responsive M&D, we can't deliver effective humanitarian action. And thank you very much for your time. I truly appreciated your attention and engagement. Now with my colleague Mohammad, as he will answer your available question that you share in the chat. What?
Yeah, many thanks for our colleagues, Mona and Mai, for the representation about the rapid gender analysis. I would like now to have, if you have, to open the floor for you, if you have any questions or comments you would like to share. Also, we'll be looking at the questions in the chat that we hope that we'll be able to answer. Yeah. Okay, we are going to look at the questions in the chat. And first question, that isn't this kind of gender analysis just a conceptual language, and how we know it's actually improves the humanitarian outcomes? That's really a fair and very important challenge. Gender analysis is only valuable if it leads to better becomes in practice, or to better outcomes in practice. In this case, we see very concrete impacts. For example, identifying female-headed households improves targeting accuracy, understanding access barriers improves service delivery, monitoring safety risks reduce harm in aid distribution. So the difference is practical. Without gender analysis, programs risk being insufficient or inequitable. With it, and with the rapid gender analysis, we design responses that are more precise, safer, and more effective. So I would say it is not about public speaking or conceptual language. It is about better operational decisions. Another question was saying that there is a concern that with remote data access constraints, or aren't our conclusions too weak to inform serious decisions? Really, I understand that concern, especially in high-risk environments. We are very careful not to overstate the strength of the data. Instead, we focus on patterns across multiple sources, consistency over time, a triangulation between a qualitative and a quantitative data. Also, we don't rely on a single point conclusion. We use the rapid gender analysis to inform directional decisions, not absolute claims. In fast-changing crises like Gaza, the real risk is not imperfect data. It is making decisions with no evidence at all, making decisions without any supporting evidence. So the balance is credible enough to act, but flexible enough to adapt, which means that strong enough to act upon and open enough to accommodate change. There is another question from one of our colleagues here that they are seeing that it seems that it's heavily focused on women and girls, are not yet neglecting vulnerability of men and boys. Really, thank you for this, which is very important point. A strong gender analysis includes all genders. We don't differentiate between women and men, boys and girls. In our findings, we specifically highlight risks faced by men and boys, including violence, detention, and livelihood loss. High levels of psychosocial stress among men also is included. So the goal is not to focus only on women. The goal is to understand the difference and different risks and vulnerabilities across all groups, men and women. In fact, ignoring men's vulnerability would be just as problematic. So this approach is about inclusion, not exclusion. So we are including men and women, boys and girls in this analysis or in this approach. I will let our colleague Mona answer the following question, which is about in an emergency like Gaza, shouldn't we just focus on saving lives rather than doing detailed gender analysis? So it is the floor for you, Mona.
Really, this is an interesting question and still related to our Gaza context. I completely agree that saving lives is the priority here in Gaza. But gender analysis actually support that goal. It doesn't contradict or compete with that. For example, if women cannot safely access aid, life-saving assistance doesn't reach them. If men face security risks, they may not be able to collect assistance. If girls drop out of schools, for example, long-term harm increases. So without gender analysis, I think even life-saving interventions can be less effective or unevenly distributed. So in that sense, gender analysis is not an additional step. In contradiction, it is a part of effective life-saving response. Also, I think we have another interesting question in the chat. It says, can you show concrete examples where this RGA actually changed procurement decisions? This is a very critical question, actually, and one of the things that we need to strengthen continuously, especially in Gaza context. In practice, we have seen influence in different areas, such as, for example, adjusting targeting. We adjust targeting to include female-headed households. As you remember, it is the core key findings that we come up after this analysis. So we adjust targeting to include this vulnerable category, also shifting distribution methods to improve safe access. Another thing, integrating protection risks measures into multiple sectors in education, health, food assistance, and different things. So we can say that this said, we also recognize that translating analysis into action is not automatic. It requires different things like strong coordination, leadership buy-in, continuous engagement with all programs. So the rapid gender analysis is a key input, but impact depends on how we well the system use it. It never contradicts that life-saving in Gaza Strip. I think we have another question here. It says, how do you respond to criticism that gender frameworks impose external values that may not align with local culture? I think this is a very valid concern, especially in our Arabic societies and Muslim societies. And this one we take seriously. Our approach is not to impose external models, no, at all, but to work with local partners, listen to community perspectives, and focus on practical issues like safety and access. And as you know, this is like a situation we are forced to go through, as the key findings like female-headed, a lot of vulnerable categories are there. So we frame gender issues in terms of reducing these risks, improving fairness, and strengthening effectiveness. These are universally relevant. They are known. So the goal is not culture change. It is better humanitarian outcomes within the local context. I think May is interesting to answer this question. What do you think, Mike? Okay, go ahead.
Okay. The question is, the finding seems quite general. How do they translate into concrete optional steps? Okay, that's an important challenge. We address this by linking each finding to specific programming implications, such as female-headed households, adjust targeting criteria, access barriers, reducing distribution points, protection risks, integrate safety measure across sectors. We also work with the sector teams to translate finding into indicators, monitoring tools, program adjustments. So the value of the RGA is not just in identifying issues, but it's in guiding. We can say in guiding specific adjustment at operational level. My colleague Mohammad continue to answer the question. Okay.
Really many thanks for our colleagues and for your fruitful and very challenging questions. Really, the findings seem quite general, but this is an important challenge. We address this by linking each finding to specific programming implications, such as female-headed households, adjust targeting criteria, access barrier, redesigning distribution points, protection risks. We integrate safety measures across sectors. So we also work with the different sector teams to translate these findings to indicators which are smart, that and measurable, that we can measure, and we are using a lot of indicators in our work, monitoring tools, program adjustments. So the value of the rapid gender analysis is not just in identifying issues, but it is in guiding specific adjustments to operational level. So it is not in identifying the issues, it is how to guide specific adjustments at operational level, at practice, on the ground. Also, we have another concern or a question that regarding the funding, that with limited funding, why should agency prioritize gender-specific approaches? Really, this is a very important and very practical concern. Gender-responsive programming doesn't always require additional resources. And it doesn't cost. It often requires better use of the existing resources, the resources that already available at our community. For example, adjusting timing or location of services, improving feedback mechanisms, ensuring safer access. So these are often low cost, with high impact changes. So we are not concerned about the cost. It concerns about the existing resources. We can use the available resources with low cost and which has a high impact changes on the ground. So this is not about adding costs, it is about improving efficiency and effectiveness. Regarding the over-reliance and perception, we have a question about that a lot of our insights are based on perception, isn't subjective or unreliable. Really, this is a good, a great technical question. Yes, perception data is subjective, but in a humanitarian context, such as Gaza, it is also essential. Why? Because perception shapes behavior, whether people access services or not. Safety is often experienced subjectively. Access barriers are often perceived before they are measured. We don't rely on perception alone. We combine perception data with the quantitative indicators, observational data, secondary resources. So perception is not a weakness. Perception is not a weakness in this approach. It is a critical dimension of understanding reality. So if we want to perceive more, we need to have an approach that has more understanding of the reality on the ground. We have another also in the chat. We have another question, which is about what's the biggest weakness or in the rapid gender analysis. I think, really this good question, and I think transparency here is critical. I would highlight three main limitations in the rapid gender analysis, which is the first one is access constraints. We cannot reach all areas equally. And this is in a situation like Gaza, we are not able to reach all the population, all the areas. The other point is reliance on remote data collection. we are using in our surveys and our data collection, we are reaching the population or the beneficiaries through remote data collection via phones, and this is in order because of the security and the security constraints in Gaza. The third point is rapidly changing context, which can outdate findings quickly. The rapidly changing in Gaza and the situation is changing all the time. Because of this, the rapid gender analysis should not be seen as a final answer, but it is a continuous evolving evidence process. And that is why we emphasize iteration, validation, adaptation. So the strength of the rapid gender analysis is not how to be perfect. It is its ability to adapt to complex situations. So the strength of the rapid gender analysis doesn't lie in being perfect, but it lies on its capacity to adapt to complexity and in its ability to evolve within complex environments such as Gaza. So I would say again that access constraints, reliance on remote data collection, and the rapidly changing in the context of Gaza, all of these can outdate the findings, but I will assure you that the rapid gender analysis should not be seen as a final. It's not a final answer. We need to do it rapidly. We need to do assessments faster in order to be able to reply to the community needs or to the needs of the population, the needs of the people. But so it is a continuous evolving evidence process. We should do it a lot all the time in order to achieve the best of our approach. And that is why I emphasize. So the strength of the rapid gender analysis is not to be perfect, its ability to adapt to complex situations such as Gaza. Thank you for your questions, and I would like, if we have any comments, if our colleagues anyone would like to participate, to share their thoughts and opinions about the rapid gender analysis, please feel free to share. Yes. Yeah. Also, we have another question: is how do we balance the need of comprehensive gender indicators across all groups in practical limits of field data collection to avoid survey fatigue? Yeah. Specific tools and what specific tools are used. As we mentioned here, that we are using. Yeah. We address this by linking each finding to specific programming implications. For female-headed households, we mentioned that we adjust targeting criteria. For access barriers, we redesign distribution points. For protection risk, we integrate safety measures across sectors. We also work with sector teams, translate in the findings into indicators, monitoring tools, and program adjustments. And also, gender-responsive programming doesn't always require additional resources. So we often require better use of the existing resources. And for example, adjusting timing or location of services, improving feedback mechanisms, ensuring safer access. And these are with low cost and with high impact changes. These are the real change that we can put in more effective and more efficient way on the ground. Okay, so thank you for your participation and for your great questions. To conclude, today's discussion highlights something very important in a crisis like Gaza. In a crisis like Gaza, we cannot afford to rely on assumptions. The rapid gender analysis is not about perfect data. It is not about theory. It is about making sure that our decisions are informed by evidence, responsive to real needs, and adaptable to a rapidly changing context. As we discussed, the real risk is not imperfect data. It is making decisions without any evidence at all. At the same time, we must stay realistic. This is a dynamic environment, and our analysis must evolve with it. That is why the strength of the rapid gender analysis is not in being perfect, but it is in its ability to adapt to complexity and guide us through it. But evidence alone is not enough. What really matters is how we use it. What really matters is how we use it, how we adjust our programs, how we improve access and safety to different areas, and how we ensure our response is equitable. So the key question going forward is not what does the analysis say? It is how will we use this evidence to make our response better? This is a shared responsibility for all of us who are working in humanitarian responses in Gaza and other areas where there are a lot of crises. We should ensure that our humanitarian action is not only responsive, but truly inclusive, effective, and grounded in reality. Thank you very much for all and for your being patient for this presentation.